We have been illustrating this treatment concept by showing how we use Urias splints to help us in the arm rehabilitation. But there are some leg problems, and Urias again have helped us over this. They've produced this splint. It's a leg gaiter which has 2 inflation tubes and 2 separate chambers. I'm going to apply the splint to Anne, and she's going to describe what I'm doing, and she's going to explain why it has the 2 chambers, and we can get different pressures in each chamber.
The splint is put round the patient's leg with the zip going down the outside edge. The zip is closed, making a posterior and an anterior chamber. The patient's foot is correctly positioned with the toes facing straight forward, and the upper level of the splint is under the patient's ischial tuberosity. The posterior chamber must be inflated first, and as it inflates, the patient's knee is forced into mild flexion, and with increasing inflation pressure, the patient's heel is forced down onto the ground. The anterior chamber is then inflated. This is inflated enough to give stability to the leg, and the patient's foot is now weight-bearing with the weight going through the heel, through a semi-flexed knee to the hip.
Now the purpose of this is to cut out the dominant anti-gravity tone. To weight bear on the limb increases tone. So what we want to do is to increase the low tonal pattern while we inhibit the dominant anti-gravity tone. So virtually we want to stop the thrust of gluteus maximus. And we've done that by correctly positioning the foot so that we've got a slightly internally rotated hip, down to a slightly flexed knee, and straight on down to weight bear on the heel. And then the patient, when she weight bears, is going to increase the low tonal pattern, while this splint is maintaining the inhibiting position. Lift your left leg off the floor and down. Training begins by making quite sure that we stabilize the patient again, that we get weight through the affected side. Push me here, and then lift. Now, can you maintain that position for a minute? And you'll see how she's weight-bearing entirely now through the affected side of her body. She's got a good elbow position. She's got a good hip position. In other words, her weight-bearing positions are correct. And she's increasing the low pattern, and she's learning to weight bear through her affected side. Stand down again. And then we start fairly simple training. Feet astride, take your weight from side to side. And over to this side. And stay there and step forward with your left foot and step back with your left foot. Or the therapist can sit behind the patient where she can place 2 hands on the pelvis and really influence the movement to get the hip forward, to get the weight bearing correct. We have found that this splint is invaluable.